Okay, we are live. Let me bring out the handy dandy. Let me see. Here's this one. See, here's this one. All right. I'm just going to share it really quickly. See, share to the groups. I'm just sharing. I don't even know what I just pushed. I'm just sharing things. All right, almost done. I do not know I was in so many groups. All right. Okay. Hello, and thank you for joining us today on the Sickle Cell Experience Live. We will be talking about all month sickle cell complications. But before we dive into all of that great stuff, we're going to start with the introductions. I am Shay Breon Howard. I am the co founder and co host of the Sickle Cell Experience Live. I am also a writer, filmmaker, photographer, graphic designer, you name it. You name it.
Yeah, just talented all around.
Yes. So just, all around talent. I'm a mother of a beautiful sickle cell trait warrior, and I'm also the daughter of a sickle cell patient. My mother actually passed away from complications of sickle cell when I was younger. So that is who I am in a nutshell, and I will pass it to my lovely guest, Tiana.
Thank you. Well, I am Tiana Wolford. I am 30 years old. I turned 30 in July, so that was exciting. I wear a lot of hats. I am SS warrior, advocate, and co-founder and CEO of the Sickle Cell Reproductive Health Education Directive. And I'm excited to add to the conversation.
Awesome. Um, all right. So today's topic is okay. Hold on. Let me. Our next guest, before I go any further, let him introduce himself. Alrighty. Hello.
Hello, everyone.
All right. Would you mind introducing yourself to the people in Facebook and YouTube land?
How y'all doing? My name is Andro, uh, better known as Ty throughout the community. I have sickle cell SS, and as of now, I reside in Shreveport, Louisiana. However, I will be in Dallas, Texas, come November.
Awesome. All right, so let's just dive right on into it. Heart and lung complications due to sickle cell. It is unfortunately common for sickle cell patients to have these complications. Pulmonary hypertension, that's something that I struggle with. I've struggled with for probably as long as my daughter has been alive. And I also have asthma. Asthma is something that's definitely prevalent in the sickle cell community with sickle cell patients. Yeah, let's see what else. Let me break the list out. I'm going to talk about these things as a personal experience. I can't speak to the um, cardiovascular complications, but pulmonary hypertension is pretty much both. It's the way that the pumps to the lungs, it's not normal. Pretty much, it's too fast. Is it too fast or too slow? I think it's too fast, right?
Pass.
Yeah. Okay. So that is definitely, I guess, the only complication I could say I have with my heart. And I have also suffered from acute chest syndrome. One of the first times that I had acute chest, I almost died. Like, I think I was 13, and it got really bad. And I really felt like I wasn't sure. Like it was I was in ICU. It was really scary. You know, I had a moment where I literally heard another patient pass away, and I felt like, okay, am I next? Like, because of all the complications, because of the panic in everybody's, voices and demeanor, I wasn't getting better, I was getting worse. So it was really a one of the terrible experiences for myself, and that was the start of me having to be on like 6 different medications. Um it got pretty bad. Uh I personally think that when we were in a hospital and they give us what do they call the is it spirometer?
The incident spirometer.
Yeah. So a lot of people, they kind of just set it to the side and they're like, "Oh, it's okay." Really and truthfully, like, I turn it into a game at home. I literally have one at home, and me and my daughter, we play with it because it's real. Like, I have to wear oxygen at night. I have to, if I know that I'm walking somewhere, it's to the point where sometimes I have to take my oxygen with me. Like today I went to the store and I left my oxygen, honey. I was at the store like, oh man down. I don't know what's going on, but it's not a great feeling when you go through stuff like that. So I really thought that this was a great opportunity to talk about these things and let people know that they're not alone. Let people know, we go through it too. Even as advocates that do all these great things, we still have sickle cell on our backs just like everyone else in the community. So, Tiana, I just want to pass the mic to you so you can talk about your complications. Um,
Well, I'm glad that you brought up that whole incident spirometer thing because, like, I hear Dr. Wanda Witten-Sherney in my head because that's something that she's on, like, every warrior about is the importance of that incident spirometer and, like, keeping those lungs clear. Even if your lungs are healthy and you're, like, in the bed in pain, you should be doing that. So I'm glad you brought that up. But really, I always, like, when I do intros and stuff, I always say that I was pretty healthy as a child. And I need to stop saying that because I was just saying that, meaning like I didn't have a lot of VOCs, but I was getting hospitalized with acute chest syndrome like once or twice every year. And that was kind of what made me come to the realization that, like, oh, okay, this might be something to the sickle cell because I was getting on it. They put me on hydroxyurea for that reason because it had been proven to decrease, that acute chest complication. And I remember being like 11 and not taking it, like not being compliant, and my doctor, my social worker, my family, like literally doing an intervention. Like, no, you don't understand. Like, next to stroke, acute chest is what can take you out of here. So I dealt with that a lot. It's definitely decreased with hydroxyurea. And then, like, really, as an adult, though, I've been dealing with pulmonary embolisms. So I've actually had six in the last like 5 years. And most of them have been relatively large in main arteries. And then, that's a complication because a lot of oral contraceptions put you at higher risk for blood clots. So that's something that I hear a lot about from others in the community as well. And um, what I just found out recently, because I've tried like four different blood thinners, and I'm so confused about how I still keep getting these pulmonary embolisms. And what I learned is that because of how sickle cell kidneys don't operate properly, I don't metabolize those blood thinners well. So now I'm doing the daily Lovenox injections. And so I think that's another misconception that we as advocates have to dispel, because I'm like, what do you mean my kidneys won't function properly? Like, I thought my kidneys were fine. All my tests, my creatinine, like all of that is fine. And she was like, oh no, like it's just how sickle cell kidneys are set up. And I think a lot of times we have this false sense of security, like, oh, well, if we're not having frequent VOCs and getting hospitalized, we're 100%. And that's not the case.
Yeah. Honestly, I totally agree with you. Like, I was that person, like, oh yeah, I rarely went to the hospital, but
Yeah.
but when I went,
Yeah.
okay, Ty, you wanna give your
So is this strictly just on lungs or complications of the lungs and chest?
yeah, like lungs, heart, COVID, if you had like anything that's like, a complication that you had dealing with sickle cell.
Okay. For the most part, I can say that I'm blessed in a way that I've never had acute chest syndrome my whole life that I know of or any doctors know of. I've never dealt with that, and I pray that I never have to, as I've heard is very painful and serious. I've never had any strokes, silent or anything of that nature. I've always been good there. Um, I do have an enlarged heart or a heart murmur. Um, And I've been told that since I was, 7 or younger, I believe. I was diagnosed at the age of 7 with sickle cell. Anytime before then, the doctors were telling my mom that I was basically just having growing pains. Um, let's see. If I had to think about anything lung related, I noticed that I get pneumonia a lot, or used to get pneumonia a whole lot. Um,
Mm-hmm.
I never knocked it up to it as being a complication of sickle cell. I just, in my head was like, oh, I just got pneumonia again. It wasn't until like I got older that I kind of understood that that may just be part of sickle cell in a sense, me being able to catch it a lot easier than most probably are able to get it. But as far as anything, I feel like I've been pretty well blessed in that sense and in that category. I've dealt with other things, but when it comes to my lungs, they're usually pretty good. Um, with the incentive spirometer, that is literally a competition in my house. That's what I've made it. Whoever can get the highest gets this amount of money or this toy, this whatever it is, whatever that price is. We've made it a competition. Let's see who can get it the highest, and whoever can out of so many turns, win something.
Mm-hmm.
So I
Now,
love doing that with the family, but other than that, I don't really have much else.
let me ask you something, because I've also had, and this can go for everyone. I've also had issues with having pneumonia a lot, right?
Yes.
Um, and it always starts out like the cold or the flu or something like minor, and like instantly it's pneumonia in like a couple days.
Yeah.
Is that something that's common with you, you all as well? Or
Yeah, I was looking at the comment that just came in because when Ty was sharing that, I was like cringing because that's something where we need more education, not for the warriors, but for the providers. Because oftentimes on a CAT scan, you can't tell the difference between pneumonia and acute chest. So they should be treated as one and the same. So I'm like, I hate to tell you this on here like this, but you probably did have acute chest and they didn't know. But no, you know what's interesting? When I have acute chest and stuff, it doesn't start off like a cold or anything. I instantly get chest pain, and it's happened to me where I've like shown up in the ER and like my chest hurts. I have pneumonia. I have acute chest, and it doesn't show up on the scan. And they've sent me home, and then I come back with like a high fever and chest pain. They're like, "Oh, you were right." I'm like, I know. And then that's another thing too, is like a lot of times they'll just do a chest x-ray and think you're in the clear. But a lot of times acute chest and pneumonia, especially if it's in that early stage, it won't show up on the x-ray. You have to do a CAT scan.
absolutely. And also I noticed for myself, if I got sick and I was prescribed like a Z pack,
Mm-hmm.
for some reason that just was like, nope. Instantly I'm gonna get worse. So
Really?
yes, Z packs don't work for me. I no, it's not for me. I definitely, that is not something my body um, can tolerate anymore. Okay, so we have a new guest that joined us. Hello, Ashley. Do you want to,
Hello,
um,
everyone.
intro?
Yes, I'm Ashley. I have sickle cell SS, and I'm happy to be here.
Okay. What is your what complications lung wise or heart wise have you had? Um, in your life. It doesn't have to be now. It could be when you're a kid.
Okay. Oh, several. I've had multiple pneumonias, bronchitis, acute chest. I've had to be intubated several times. Pulmonary hypertension, which is why I have to wear the oxygen now. Two different type of pulmonary hypertension. Um, a lot. Asthma, um, even stuff from like when I've had infections and it, went in my bloodstream and got complications with my lungs, um, and other organs. Um, Trying to think what else. Um, Also, this other thing that I was just diagnosed is kind of familiar. It's kind of similar to cystic fibrosis, but it's not. But it's kind of dealing with the same thing. So I have to do this what they call the vest therapy, and I have to do that like 3-4 times a day, just so I can be able to cough up the phlegm, because that causes me to have pneumonia or acute chest syndrome. So when I can't cough up the phlegm, then it just gets worse. So I do that, and then also neb treatments a lot of the times. It's just been a lot.
Okay. Uh, wow. That you did explain a whole lot. Just even, we lost Tiana. She had to go, but I just wanted to um touch up on like, is there anything you both think could have done to kind of prevent any of the complications like pneumonia or anything like that that you've had, like things that you learned over the years. Like, say for myself, I realized that getting the pneumonia vaccine really works for me. Like, I haven't had issues like that since I started getting the pneumonia vaccine. So is there anything that actually, works that, you want to talk about here today?
Yeah, I mean, I get the vaccine, but I've gotten it and I still get pneumonia or acute chest. Um, but I know, like, with the acute chest, when I was getting like regular exchange blood transfusions, I didn't have it like I would without not getting them. And then just having a lot of lung problems, that also affects it more. Um, like the blood flow through my veins, like a blockage. I've had several blockages, so I retain fluid, so that doesn't help my lungs out at all. So just pretty much listen to my body, know what works and what doesn't, or what makes me like go into having pneumonia or acute chest. Like just pay attention to the small things like the weather, um, especially in the winter here. Like dressing for like it's really cold in the winter. Things like that play a big role. Um, Even when I used to smoke cigarettes, that didn't help. Um, so I've learned a lot over the years.
Hmm.
And I just have to keep doing what I'm doing, like keeping, everything, make sure I'm taking all the medicine, make sure um, I'm doing everything I need to do, doing the vest therapy every day, the oxygen. Before I wasn't even wearing the oxygen like out, but what woke me up was when a warrior died. She passed away and she had pulmonary hypertension. So I mean, it's real serious. I couldn't stand wearing oxygen, but I know, I want to live and have the fullest life, live my best life. So now I just do it. And I had to do it before, and I was able to get off the oxygen. So now I'm trying to do everything I can, even go to lung. They have like this rehab. It's kind of like, physical therapy or occupational therapy, but it's for the lungs. So I'm going to start doing that. Just like little things. It could be even something simple that makes a big, big difference.
Absolutely, yeah. I totally agree. Like, I know for myself, I can't be around cigarette smoke,
Hmm.
like, whatsoever. That is just absolute no. What
Yeah.
about what about you, Ty? Is there anything you found that's, helped prevent or at least help uh, you know, for the pneumonia that you've gotten in the past?
I can't say that I've narrowed that down, so to speak. A lot of times, even when I've had pneumonia or anything, I don't get chest pain. Uh, so I don't get any of the, I guess, the normal warnings that everyone else gets. When I find out, it's a surprise to me. Like, what you mean? I'm breathing just fine. I'm not having any issues. I'm not understanding. But for as far as triggers on everything, I do my best to get as much rest as possible. In this time, I probably don't get enough rest. If T was still here, she'd probably be, shaking her head at me and pointing her finger all at once because she tries to tell me to rest, and I'm just like, that ain't gonna really happen. Um, I do try and keep my fluids up. I literally uh, increase my fluids all the time, trying to get higher and higher to the point that I've made uh, little competitions out of it, to see who can drink the most water in that day with my family, and trying to keep us each other motivated to keep moving forward with drinking water and staying hydrated. Um, Other than that, there's not much else that I can think of. Even when I'm not sick, I do play with the incidence barometer. Like, that's not just while I'm sick. That's kind of like I told you, a competition. Hey, this is family game night type of thing. Like, we'll pull that out with Monopoly and
Hmm.
whatever other game we gonna play. That is literally just something that I do to help with everyone's lives in the family. All three of my children have trait due to me having the disease. So, I try and educate them on it as far as being hydrated and staying, focused and all that. They also have asthma. I'm not sure if baby girl has asthma yet, as we haven't, tested her for any of it. But I do know that my sons have it. And so the trait plus the asthma and all that, I try my best to teach them, how to build their lungs up and build their lung capacity. And one of those ways is, the incentive barometer, taking walks, doing speed walks, or anything like that. Um, but that's really about it.
Yeah, I was just saying the same thing a little while ago. Me and my daughter, we turned it into a competition as well. See who can go the furthest, the longest. We have a question from Leah V. Vasquez Ward. She said, "Does tea help you guys? Sometimes tea helps me." Um,
Help us in what way do you mean? Is
yeah,
there a specific way that you're looking for it to help, or
yeah. I know for myself, I drink different types of tea. There are some I have ginger, turmeric. So those things are anti-inflammatory, which is good for your lungs as well. It's good for your overall body. I try my best to keep everything, you know, running. Hello, Cheryl. Thank you for joining. Hi, Brianna. Okay, yeah. So,
Hi,
I mean, in
sorry
that
about that.
sense, yeah, it helps. But I mean, it, I think that's. I try to just tea is good for you in general, depending on the type of tea that you drink. So, yeah.
Yeah, she said if it helped
yeah,
for a
as
shorter
she
breath.
said,
Well, it doesn't help me. It doesn't help me with shorter breath.
Hmm.
as Shay Brown said, I drink different types of tea for different times. The ginger, turmeric, all of them in a sense. It just depends on what's going on and how I'm feeling and what exactly it is that I'm using it for. Um, and that's kind of just how I go about it. I am trying to incorporate Demetrius is smoothies and all of his teas that he does. He makes his tea and he usually infuses it with moringa seeds and uh, lemongrass or something of that sort. I don't remember everything that he incorporates because I'm still just kind of getting the recipe down and seeing what it is that he does for different things. And so I try and trying to incorporate that into my daily life where I have at least one of the beet smoothies and then one of the teas. And I'm trying to do the tea somewhat midday or early in the morning. And, the beet smoothie, I kind of just decide on when I want to take that throughout the day. Sometimes I'll try and make that, just my lunch in a sense, uh, because I am changing up my diet as well. I kind of do more of a intermittent fasting, so I probably won't eat but one meal a day. Part of that is just me doing it on my own, as well as me just being so busy working, two jobs and things like that. I don't always have time to eat or anything like that. So I try and find different healthy ways to help. And when it comes to the lungs, I do my best to, find any fruit, vegetables, or anything that helps with that. And I kind of do that for everything, for every organ. As the older I've gotten, I understand that when it comes to sickle cell, we have to remember that it's just not the pain, and that honestly it complicates and affects every part of our body, organs, and muscles, and all of that because it deals with oxygen getting throughout the body. And if you're not getting that proper oxygen throughout the body, then those muscles, those bones, those uh, joints, all of that are going to fail somewhere and somehow in some way. You have to, get the proper supplements or the proper amount of all of that, whether it's the oxygen and the nutrients, all of it. So I'm doing my best to work on figuring out how I can naturally add that in so that it helps me.
Okay. We have a new addition to our talk, so I just want to give Brianna the floor to introduce herself and talk about what complications she has had, uh, whether it's heart, lungs, and also, oh, we lost her. Okay, let's see. She might come right back. Okay.
I have
I
Well,
was
stuff with the
introducing her
heart
and she
too,
bounced.
Shavrion.
huh?
I said I have stuff dealing with the heart too. I didn't mention
Oh, what heart complications do you have?
congestive heart failure. I'm always tachycardic, even when, especially when I'm in pain, and it always happens. And then I have iron in the heart now, from all the blood transfusions, iron overload. So I have to do that medicine now. Um, what else? Um, yeah, that's it for the heart. And then like I've had like heart infections, but like endocarditis.
Okay, so how do you,
I get that.
manage those specific complications?
Well, those complications, one, I had to do like antibiotics for some months for the endocarditis. Um, and then the congestive heart failure. Um, it's pretty much the oxygen that helps with that too. Like, not overexerting myself, avoiding a lot of stuff that will, just make me feel like, weaker, tired, or, more heart race and stuff like that, like stairs, stuff like that. And then pain I sometimes have in my heart. That acute chest and pneumonia, they all pretty much have the same symptoms at first. Now, over the years, I can tell which one is which after like a few weeks, but majority of the time, probably like 2 times, I didn't have any symptoms at first. Usually, I'll start having a few symptoms here and there, like they'll come and then they'll go, but then it'll hit me like all of a sudden. But when that happens now, I pretty much know, like, can't breathe, in with the oxygen, the pain, shortness of breath, no energy. So I know to go right in, especially if I've tried to take care of it at home and it didn't work. Well, yeah, because at first I really never went in. I just waited, but that ended up causing me have to be intubated. So now I pay attention. I pay attention to everything, every detail, everything my body's telling me. I pay close attention. So yeah, that's kind of how I learned over the years,
Okay.
my experience.
Brianna, we got you back,
Yeah.
so I just want you to, introduce yourself and talk about your complications.
Yeah, so my name is Brianna Capers. I'm 27. I have sickle cell SS. I am also a COVID survivor. And a lot of the complications, most of my short life, as I like to say it, have mostly been issues with my lungs. It was never even so much crisis, it was always my lungs, either acute chest, pneumonias, asthma flare ups, simple cold would trigger me, and still does, will trigger me and land me right in the hospital. Um, in regards to my COVID experience, I actually think I had COVID twice. I first got it in early December, and COVID, as you guys know, was not really a thing at that time in 2019. Um, and so I didn't know. I had actually went into the emergency room um, for a pain crisis, and 2 days later, being admitted for the crisis, caught some unknown respiratory virus that just completely knocked me out. Was in was very sick. Oxygen levels very low. Even the oxygen wasn't helping at that point. And the hospital, particular hospital I was at, they weren't very well equipped to really take care of me the way that I needed to be. It was a local hospital. And so I was trying to transfer to the hospital I usually go to, where they're well more equipped and have a lot more of the respiratory equipment, that you would typically need as a sickle cell patient, and including things like BiPAP or CPAP, just basic, to me, basic things. And so that was a difficulty. I ended up, I like to call it, being held hostage for 9 days. They refused to transfer me, and I had to, thank God, there was a hematologist there that saw how sick I was and agreed to discharge me on the condition that I go straight to my hospital. And but even while I was in the hospital that I usually go to, I was in my entire, from first time I ended up in the ER with the crisis until I finally went home, was a total of six months. And it was the longest 6 months, and the most, just mentally draining 6 months of my life. The back and forth, just trying to recover from whatever initial infection I had. And then right away, about 2 months before I finally went home, or 3 months before I finally went home, right away I knew I had actual COVID. By then, it was March, April in there, and COVID was full blown. And I knew right away my symptoms completely changed. I was just as sick as I was the first time. Thankfully, I had what was considered a mild case, but it never feels mild. Um, and of course, you're in isolation by yourself. Especially even today. No visitors, are very limited. And so, just going through all that experience, and having to deal with it alone was very difficult. And it took me a long time to recover, and I don't know that I fully am recovered, because with COVID, you just don't know. They just don't know what all the side effects are. They don't know what the lasting effects are. Everyone's experience with it is different. And so I'm very fortunate I haven't had any noticeable effects, but there are small things that I think are lasting and residual things from having COVID. And I don't know if those things will ever go away, but I deal with them and I manage them. And it's mostly small things, fatigue, which as sickle cell warriors we all have anyway, um, but just more so, and just little things like that. Having to actually get in with a cardiologist because, as you know, COVID can cause heart damage, and even just my general overall state that my lungs are in have changed. I'm way more sensitive now, I think, and you can actually see the effects of the COVID on my imaging now. So um, it's very, it's been a very interesting experience, and but yeah, I've always had issues with my lungs. That has always been my main issue with this disease. was my lungs, and especially being premature, that played a whole nother part in it. I was 26 weeks. Um, thank God I survived. I shouldn't have, but I did. But all of that plays a role. And on top of having sickle cell disease, on top of being premature and having, chronic lung disease and chronic lung damage, um, I've had to do alternative therapies like chronic blood transfusions because my lungs have just gotten to the point, and they've always been like this since I was young. They just can't take it. I've tried weaning off, I've tried coming off, and I get so sick every time. And so my body and my lungs have made that decision for me. Unfortunately, I don't have a choice. I have to do those transfusions, or there's no other option. Unless and until there's a cure.
Wow. I just want to say you are all of us, but specifically, just being in a hospital for 6 months and fighting your way back to being, yourself again. Uh, I can't say healthy again because we're all healthy-ish, right?
Hmm.
So, um, but I will say that is a tremendous, story that you have, and it's impactful because, for myself, I was in the hospital. My longest time was 2 months, almost 2 months, and I was like, I can't do it.
Hmm.
This is not for me. And so the doctors, they still didn't want to let me go. I was like, look, you gotta let me go.
Hmm.
If I die, I die. Not like that, but it was just like I really felt like you guys are trying to like keep me in this bubble, but in keeping me in a bubble, you're making me worse.
Yes.
So
Yes.
let me go, and if I need to come back, I will come back. But
Yeah.
I'm not I can't stand another day here.
Yes. And I was only in for I think 9 days at the first hospital, the local hospital, and I remember having this distinct conversation with the attending, and the nurse had actually overheard me speaking to my mom and saying, we were talking and saying I just need to come home. I was getting worse at that point, not better. And the nurse overheard me and she runs out the room and like tattletales to the doctor, and I hear the doctor outside the room. He says, well, she can't go anywhere. She's too sick. And so he runs in the room talking about, oh, I hear you want to leave and you want to go home, but you can't go. You're too sick. And I'm like, you can't tell me. I know how to take care of myself. I know how to get myself better. And if you guys aren't equipped to do it, I'll do it myself. I know how to come back if I need to. Same thing. And they were not having it. I mean, and I came to find out that unfortunately it is so common that these hospitals will try to almost like manipulate and scare you into staying. And it's like, at what point do you say enough? You're not getting better. You're in the same state or worse. And at what point do you say, I need to either go somewhere else or I can take care of this between me and my outpatient team, you know, at home? But yeah, they do everything, and it's unfortunate because some patients, don't know. They don't know their rights. They don't know that they have the choice and the right to leave, and they are very they fall for that every time. The fear of being charged, or your insurance isn't going to pay if you leave, or whatever they tell you, anything to get you to just stay. But then on the flip side, as we all know, they're also very quick to want to get you out when you're not better and you're not ready.
Yeah.
So, it's like when you need to leave, they don't want you to. And when you don't think you're ready to leave, they want you out. So,
Right. Let's just make your mind up, please. Just make it up.
mhm.
Okay, we have a couple of comments here, so I want to just go and read some of these comments because I think one of them is a question. Uh, Dennis McCullen, Ashley is a true sickle cell warrior. Hats off to you, Ashley.
Thanks,
And
Dennis.
Then we have Raquel. Um, hi, I'm sorry. Hi, y'all. I'm watching your story from Belize. Very much a strong warrior and much awareness. I have a foundation in my country just inaugurated. Yeah, inaugurated the first of this month. Sorry, I had to make sure. Um, all right. And then
Congratulations.
yeah, congratulations to that. I'm happy for you. And then the question is, as warriors, do you guys recommend kids that are warriors to take the vaccine? Uh,
I
Mm,
do.
I'm sorry, I can't. I've not taken the vaccine, and I doubt that I will take the vaccine. I don't plan on making my sons take the vaccine as well. Unfortunately, I just don't feel comfortable with it as of right now. I don't feel that
mhm.
there's enough research, and I'm starting to feel like we are their test subjects. They're in the, testing stage. They had the hypothesis. We're the test, and, from their test, they'll get their conclusion to make it better. I also don't like the fact that, with the COVID vaccine, it still doesn't necessarily protect you. The fact that you can still catch it or catch, lately it seems that those with the vaccine are catching the variants more than those who just haven't been vaccinated. I'm not absolute positive on those numbers and those percentages, but for what I do research and what I keep up on, that's just what I'm starting to hear more about and the consensus on it. And I just don't feel comfortable at this moment to be doing that. I did have COVID. I got it in June of 2019. Uh, they said I was asymptomatic, and the only reason I even found out that I had it was, I went into the ER for a normal crisis, trying to get treatment. Uh, Hemoglobin was down to like a 6.5, and they were like, we have to admit you. We're gonna get you some blood and do a blood transfusion. And at that time, they were testing everyone before being admitted and being moved up to the floor, and they happened to test me. And when they came back and said that I had COVID, in my head I was like, y'all sure y'all tested the right swab? Like, I really just didn't understand it. And, I was following all the guidelines, doing everything that I was supposed to. I didn't really go out if it wasn't me going to work and coming home. I wasn't really going anywhere, so it didn't make sense to me. When I finally did get admitted, I can say that I was blessed in that sense because I had no symptoms. My taste was there, my throat, everything was fine. My oxygen was great and everything. Truthfully, the doctor told me, she was like, honestly, if it wasn't for the fact that you had a blood infection, I'd send you home because you're not having any complications or any issues other than that blood transfusion for me to keep you here in the hospital. And so I guess you can say, like I said, in that sense, I was blessed enough to not necessarily deal with what everyone else is dealing with and how they're going through it.
Okay. I know personally for myself, this is how I feel. Get it or don't get it. It's all up to you have to make that personal decision for yourself and your family. I myself have been vaccinated. I struggled for a long time because I did not know if I wanted to, but I had a conversation. I have a parenting series with Master Bird, and we were actually talking about this on Friday. I have a daughter. She's in school, but she's not of age to get the vaccine. So, her being homeschooled for a year and a half, or however long that was, it felt like forever. But she's very smart and intelligent, and she's very advanced. So it wasn't good for her specifically. and it was taking a toll on both of us for her to be, you know, to do school from home. So I had to make the decision to send her to school. And in sending her to school, I am my daughter's only person. I am a single mother. I take care of her. So I had to make the decision. If she goes to school, she has the trait, right? So her immune system is already low. So I had to make the decision, if she gets sick, I have to be able to take care of her. And I can't, like, oh, stay away if I don't have anything to protect myself as well. So I really did it for the strength of my family, because my daughter is my family. That's my immediate family. So yeah, you just got to make that personal decision. I'm not mad at people who choose not to. That's your prerogative. I feel you. I just feel like this, sometimes you just need a little extra protection. You do the research, and if you find that it's something, you have options, then do it. My hematologist made a great point. He said, you are way too high risk of a patient to even dream about not doing this vaccine, because you have lung issues, you have kidney problems, there's way too many things going against me, that if I got COVID, it would not be pretty. So to protect myself in any way, that was the best option. So that's just how I feel about it, you know.
I
And
definitely
I don't know
respect
if you
that
guys.
completely.
Go ahead.
Oh,
Um,
I'm sorry.
my take on it is that, okay, I'm gonna be honest. When they first came out, I was against it. I was like, oh no, I don't want it. I'm not having nothing to do with it. I know parts to it. But then time goes on. My mom was like, no, you need to get it. You need to get it. You have a low immune system. You have all these health problems going on. Like, you need to protect yourself. So I ended up talking to my doctor, and my doctor kept telling me, like, you need to get it. He kept telling my mom, man, if she gets COVID, she probably most likely will not make it from all the lung problems, the heart problems, everything that I've been through with it. I would not make it. So once I talked to him and talked to my hematologist, nurse practitioners, plus, you might be around someone, and if it's like everyone, a lot of people are against it. And as a country, or the whole world, if so many people don't get it, it's not a good chance for the whole wide world, because all these variants are coming out. You might not know if someone has it. They might lie and say they got the vaccine. You're around them and they didn't. And then they just keep spreading and spreading and spreading. So that's the only reason why I got it. But I mean, yeah, everyone has their takes on it, and some people was like, no, I'm not getting it. My kid's not getting it. But I feel like, as we are warriors and we already have a low immune system, so we need to protect ourselves. If we
That's right.
do get it and we get the vaccine, yeah, our chances are not we're not going to pass from it. It won't be as bad as if we got the vaccine rather than we didn't get the vaccine.
Mm-hmm.
So
Mhm.
I think my feelings is everyone should get it. Even kids, it's killing so many kids already.
That's right.
It has taken so many children's lives. It's just sad. Teenagers, even adults, the elderly, like, it's just a big mess. A big mess. So I'm for it. I'm for it.
Oh yeah, I definitely agree. I mean, even just me personally, it was kind of a very similar story. Combination of with the lung issues and everything else. My doctor told me you can't afford to get COVID. And then on top of that, I have my mom with me who has cancer also, and I can't risk her getting sick or even me getting sick. I mean, I had happened to get it, but this is before there was obviously a vaccine. But even when the vaccine came out, yeah, was I hesitant? Of course. With all these experiments and history, and we all know, we have a right to be skeptical. We have a right to be hesitant. But at the end of the day,
as warriors with a illness that has serious and major complications that come with it. You do not have the luxury to just take that gamble. Yeah, okay.
Right.
You might, and again, it's everyone's choice. Everyone has a choice to make, right? Some people just are not comfortable. We have a family friend that we were very close with who passed from it, and so, it's one of those things where you get it and you might have mild symptoms and be okay. But then again, there's been research, and they have actually, and you can look this up online. They did a registry specifically for sickle cell patients and COVID, and every sickle cell patient that came in that was tested to the ER or in the hospital or whatever, went into, the doctors were able to report it, and they found that unfortunately, as warriors, when we were getting COVID, yeah, some of us were doing okay, but then a lot of us were ending up in the ICU, intubated, and or passing away. And the numbers were made me not comfortable with taking that risk. So as soon as that vaccine, came out, I unfortunately wasn't able to get both because after the first vaccine, they said because I had already had COVID the first time and I had antibodies, that first shot was kind of like my second. And so I had a pretty severe reaction to it and ended up in the hospital for another 2 months. Um, but again, that was just my own hypersensitivity with my lungs, And but as soon as this next shot, this third go around comes out for the compromised and people that are high risk for it, I'm gonna get it because
I am too.
I do not want COVID again, and I don't, and it's not worth it to me to risk something. It's like, do I want to potentially pass from COVID, or do I want to live and manage my sickle cell and, you know, live a good 40, 50, 60 years? I don't want something preventable. And that's the thing I think people don't really think about sometimes is a lot of this. I think of all the people that have died and how preventable it was. All these
Right.
children and elderly people passing away, and just people in general, how many lives have been lost that could have been prevented, and it's sad, when there's something that can, it might not protect you 100%, but it's better than ending up in an ICU somewhere intubated, not being able to talk, not being able to breathe, and risking your life for something so small. A vaccine, you have a few side effects for a few days, and then you're fine. We get the flu shot. Most of us seem, get the flu shot, and we're fine with that. And again, it's everyone's personal choice at the end of the day. But I just don't think it's worth it when you have a disease that has high risks already. Why take that chance on top of having a disease?
Yeah, I
I
definitely
definitely
see your
respect
point.
it.
Yeah, I see your point. And like I said, whether you get it or you don't, that's totally your choice.
Mm-hmm.
I'm not one of those people, oh my God, I got it and you're such a bad person.
No.
No. Like,
My main thing is
free.
I don't. It's not that I won't get it. I just feel I need more of an understanding and more research
Mm-hmm.
before getting it. I just don't feel comfortable at this moment in time. Not saying that that won't change or anything of that nature. And until I get that information that I'm looking for, that where I have more confidence in it, I'm just going to do my best to stay uh, quarantined in a sense, stay in the house unless I have to be out. And I definitely make sure to keep my mask on and things like that.
Yes.
I still wear my mask. Sometimes I wear two.
Mm-hmm.
I don't play that.
That's right.
Nope. So thank you all. We come up on an hour. I don't know if there's anything else you all want to speak about, but uh, we have some great comments. You guys that are commenting, thank you for being so interactive with us.
Sorry.
Right. Thank you for being um, present. And if you could do us this great favor and share this video, because there are people who need to know they're not alone in the complications that they face because, as a result to having sickle cell or just dealing with sickle cell and then having these complications. However you would like to put it. That's just the reality of it. You know, there are people who right now may be going through pneumonia after acute chest, and they thinking it's never going to end. I'm here to tell you, it gets better. You just got to figure out what works for you. Because there are triggers for everything. So find those triggers, find what works, find what helps you to combat whatever you're dealing with in that capacity, and know that you're not alone. Know that you can reach out to people. And I just want to thank you all for being here. Thank Tiana for coming, for the time that she came. I truly appreciate her as well. I know you took time out, so I really thank you for that. Is there anything you all would like to say before we end this?
Um,
I'm sorry for your loss, Leah. I mean, yeah, and I'm sorry. And sorry for your loss.
Yeah, I'm sorry.
Yeah.
Definitely sending my condolences to you. I understand how hard that
Right.
is. I
Right.
lost my father to COVID um, on the 13th of June. So,
Mm.
and I think his probably could have been prevented. Unfortunately, I think, that there was some missteps as far as on his wife's side as to
Mm-hmm.
how serious his condition was and her not explaining what was really going on informational wise.
Mm.
He basically sat at home for a week, you know, uh, not being his normal self, and she just not really giving me that information. And uh, unfortunately, it came out to where I feel that if we would have got to it sooner or later, he'd still be here. And unfortunately, he isn't. So I understand that it is very serious. It's very something that we need to keep and protect ourselves from. Um, what I have to say is, definitely continue to do your best to keep your lungs and body and just altogether uh, keep yourself healthy by doing the things that you need to do, whether that's diet. Um, Truthfully, it's a plethora of things I feel that we have to mix up in order to get that better quality of life that we're looking for with sickle cell, and that comes down to making sure that your mental health is straight, your diet is straight, um, you're getting enough rest, your water intake, and things of that nature is all straight. A great thing to always make sure is that you learn your triggers, learn what sets you off, because that in the end will probably help you in a lot of different ways. I've learned that my triggers are weather. My emotions play a very big part, and stress is my largest factor
Yeah.
that sets me off. But I know that my emotions are a really big thing. So throughout any situation, a lot of people probably don't like me for it, but I'm very nonchalant about things and believe in the fact that it'll work out however it's supposed to work out.
That's
I'll
right.
put the work in to help with it, but in the end, I'm not going to stress over anything that I can't change myself. If I'm not able to change it, then there is no reason for me to be stressing over it, because stressing over it doesn't do anything but put me in the hospital, which adds more stress because then I'm in there wondering, how my family is doing and how I can handle these bills and that and different things of that nature. So altogether, just make sure that you are working on every aspect of your health to keep yourself healthy as much as possible. Um, and for those who ever need to talk about anything, whether it was a loss or just you needing to vent or anything of that nature. My line is always open for us soldiers. Um, I'm always here to lend an ear, shoulder, advice, whatever it is. I'm here to help, and that's basically my outro, I guess, for the night. Thank you for having me, Shay Brianna. It meant a lot to that you thought to have me on here, as I do want to get very much back active in the community. I'm taking my time doing so, but I'm definitely working towards it. And I thank you for thinking of me to be on this panel with you.
Oh, no problem. Thank you for
Thank
coming.
you.
Anyone else have anything they want to say before we go?
I think I would just piggyback off of what Ty said, which is learning your triggers, and not just learning your triggers, but being open to trying new things. I know sometimes, it's scary. You don't know this or that about a new treatment or a new medication, but be open and be willing to try new things because it may really help you in the long run. You know, prime example, I have an allergist that I see, and in order to help me with both my allergies and my asthma, um, she introduced me and told me and educated me about biologic shots. We've all probably seen the commercials, the new Kala and the new Vixen. Um, and so I took a leap of faith. I don't like needles. A lot of us probably don't. Um, but I did it, and it's really helped me, um, and has really improved just my overall quality of life. You know, Not going outside and having my eyes watering and my nose running, and just allergies acting up. And hopefully it will improve and help my lungs as well, in the long run. So don't be afraid to try new things. If it doesn't work, you stop, you know. Um, but don't be afraid to take that leap of faith.
Awesome. Ashley, do you have anything you want to say or add?
No, they pretty much said, pay attention to triggers, listen to your body, do everything you need to do to stay healthy and out the hospital. Even though you might, be tired of doing it, taking medicine, trying to stay healthy and, do everything you can not to have a crisis. Just, do it, you know. It'll help in the long run. You might not think so, but it'll definitely help. I've had to learn that the hard way. So I, just want y'all to just, take my advice because I've had to find out the hard way, and I don't want anyone else to have to go through, that or anything similar. So yeah, just listen to your body, keep up with your appointments, your medicines, everything. If anyone needs to, talk or anything, my inbox is always open. Um, yeah, and thank y'all for joining and interacting with all of us.
Yes, thank you again. Awesome. Um, all right. So, without further ado, I will leave you all with my positive words of wisdom for tonight. I want you to start where you are, use what you have, and do what you can. Until next time, peace.
Hi.